Hi, my name is Ana Paola Cepeda Aguilar, and today I'm going to talk about of tooth anatomy. The tooth is a calcified anatomical structure located in the oral cavity of many vertebrate species. Its main function is to grasp food on chewing, and its main component is hydroxyapatite. Now, talking about the tissues maintain the teeth, the mandible and maxillar support the alveolar ridge and house the teeth. This saliva from the salivary glands butters and to protect the teeth, and the tongue directs food between the cutting and chewing surface and helps clean the teeth. Okay, now within its external anatomical classification, it's classified as follows: the crown, the neck, and the roots. The crown. It's the upper part of the tooth, the only visible part. The shape of the crown incisors, canine, and premolars, molars, and determines this function of each the teeth. This part. This. Okay, now neck. Neck or edges of the gum is this part. Okay, this is the line of onion between the teeth and gums. It's an area to which special cares must be taken, and without proper dental hygiene, tartar and plaque accumulate along this line, which can lead to gingivitis and other gum disease. Now, the roots. This is the area of the tooth that is insert. For example, this is the root. This part that's insert in the gums. Okay. Into the jawbone, and obviously is an area that isn't visible. Well, having talked about external structures, we now turn to internal structures. Within its internal anatomical classification, it includes the enamel, the dentine, and the pulp. The enamel is the outer layer of the tooth, and therefore the most exposed to the consequence of poor dental hygiene. However, it's the hardest tissue in the human body, translucent and insensitive to pain, as there aren't nerve endings in it. It consists mainly of 94% of phosphate called hydroxyapatite and 4% the organic material. Now, the dentine. This is enamel and this is dentine. Okay, the dentine is located underneath the enamel, and it surrounds not only the enamel but also the root. It's responsible for the color of the teeth, and in addition, it contains numerous tubules lining the pulp. And these are the tubules. If deterioration in the enamel reaches the dentine, it will generate sensibility and or pain. This consists 17% on organic matter, which is mainly hydroxyapatite crystals, and 18% organic matter, the mainly collagen fibers, and 12% in water. Now, the pulp. This is the pulp. The pulp is the innermost part of the tooth. Its soft tissues contain blood vessels and nerve cells, so that dental pain due to infection, for example, comes directly from it. It's formed by lax connective tissues and collagen, reticular and elastic fibers, nerve fibers, and abundant blood vessels. an intercellular substance occupying the inner cavity of the tooth with bright and inextensible walls. Inside the pulp is the periodontium, gingiva, periodontal ligament, dental cementum, and finally the alveolar bone. Okay, the periodontal or periodontal ligament is this. That's great. And this structure that support and hold the tooth in place. Now, the gingiva. The gingiva is the part of the buccal mucosa that surrounds the neck of the teeth and covers the alveolar bone. This is the alveolar bone. Now, the periodontal ligament. This is. And the periodontal ligament, it surrounds the root and etches it to alveolar bone. And dental cementum is that. This line. Okay, is the structure that covers the root dentin. Finally, alveolar bone. This is the part of the maxillary and mandibular bone where the teeth are locked.